Greetings,
Hello.
everyone, from the Center for Khmer Studies in Siem Reap. My name is George Chigas, and I'll be moderating today's webinar. We're very fortunate today to have with us Tita Kim, who will be presenting her research entitled The Intergenerational Transmission of Trauma in Cambodian Skipped Generation Households. Before we begin, and I turn the floor over to Tita, let me just introduce her a little bit. Tita Kim holds a master's degree in family and developmental psychology from the Philippines and a master's degree in gender and development studies from Thailand. She's currently pursuing a doctoral degree in social psychology at the University of Hong Kong, and she is also a CKS PhD dissertation research fellow. She was also, I have a couple more things here. She was also a visiting PhD student at Flinders University in Adelaide, South Australia. And her research interest is in the interrelation between social and psychological factors and implications on the individual's and family's well-being and agency. Tita's presentation, again, is entitled The Intergenerational Transmission of Trauma in Cambodian Skipped Generation Households. Tita adopts a mixed method research design, surveys, and lifeline interviews. The study investigates the intergenerational effects of complex post-traumatic stress disorder, or PTSD, among Cambodian grandmothers and its implications on the well-being of their offspring in subsequent generations in migrant skipped generation households. So that's a mouthful and a lot to digest, but I will leave it to Tim to do that for us as she gives us her presentation. Take it away, Tita.
Thank you, George, for the introduction. So I will now can start with the presentation of my research study. Let me share the screen. So since I've been already introduced, so I will just now immediately start with the presentation of my PhD research project, which is on the intergenerational transmission of trauma in Cambodian skipped generation household. So the contents of the presentation today, I will cover three main parts. The first part will be on the background, literature review, objective, and the methodology of the study. And the second part, I will present the four sub-study as part of my whole PhD project. And the last part will be on the conclusion, limitation, and the recommendations. For the background, Cambodians have been through a prolonged genocide and civil war. And one of these significant trauma that really affect the young children in the genocide and civil war is the disruption of the family bond. And normally it happens through family separation and death of the parents and siblings. And even after the genocide and civil war, many Cambodians are still living in the country with political instability, extreme poverty, and violence. And many Cambodians, even they lived through the genocide and civil war, they did not properly receive the mental health care support. And there is a significant delay in receiving the proper health care is because of the lack of mental health care and the limited resources on mental health. Several decades, a few decades after the genocide and civil war, many Cambodians start to migrate to nearby country because of the poverty and debt. And this resulted, the migration of especially the middle generation, the parent generation, it resulted in many skipped generation households in Cambodia. And this kind of household normally have the grandparent, specifically grandmother, who are the primary carer for their left behind grandchildren. And it's really common now to see this kind of skip generation household, especially in rural Cambodia, because of the migration of the middle generation. And now I will give a brief review on the intergenerational transmission of trauma in Cambodian family. So before I go further, I just want to give a brief definition of what is intergenerational transmission of trauma. So it's the pass down of traumatic experience, either through psychological, physical affect to the next generation, and often through the parenting behaviors, upbringing, or biological mechanism. In Cambodian family, there are several studies that conduct specifically focused on the mechanism of trauma transmission within the family. The first study start with the Phil and his colleagues. What he found is one of the key mechanisms for trauma transmission within the Cambodian family is the parenting style, specifically the role reversal parenting. And this evidence is stronger within the daughter compared to the son. Also, another study also found that the key mechanism of trauma transmission in Cambodian family is the family functioning, including the parent-child relationship, communication, and parenting involvement. And also another study found more like a direct link between caregiver, the mother trauma symptom, and their children, the link to their children traumatic experience. And this also found mostly significantly in daughter. As part of this PhD research project, I also conduct a systematic review with the main focus on the mechanism of intergenerational transmission of genocidal trauma. And with this systematic review, I was able to include 36 studies from 7 countries that experienced the genocide after the World War II. From this review, I was able to identify some key mechanism of trauma transmission within the family, specifically focused on the genocide context. So the first one it's on the parent-child communication, which is involved the silence of the trauma experience from the caregiver. And even when they start to communicate, it's mostly violent and ambivalent. The second point is related to the parenting style, which mainly the role reversal parenting, the overprotective on or rejecting parenting. And the last point is on the parent-child attachment. It's involved the distant, ambivalent, or rejecting parent-child relationship, or the abusive parent-child relationship. So from the systematic review, I was able to identify several methodology gaps. The first gap is related to the lack of mixed method research design in understanding or exploring the intergenerational trauma. The second methodology gap concerning the apply of the theoretical and contextual sound measurement that was able to distinguish the genocidal trauma from the life stressor experience of the caregiver. And also not because most of the study focused mainly on the genocidal trauma experience of the caregiver, and not many study conduct or assess the children trauma exposure. And lastly is concerning the cultural and contextual uniqueness of the individual, because we believe that trauma is experienced and coped differently depending on their own culture and context of each country. From this review, I was able to come up with the 2 main research objectives. The first objective is more like to examine the intergenerational effect of grandmother lifetime trauma in the skip generation household in Cambodia. And the second objective is to explore the journey and the narrative of the coping responses to life traumatic experience among the grandmother and how it contributes to their post-trauma recovery. And I asked three main research questions. The first one is concerning the mental health implication of the grandmother within the skip generation household. The second one concerning the mechanism of the intergenerational transmission of trauma and how it's affect the well-being of the children in the subsequent generation. And the last question concerning the responses of the grandmother, how they respond and cope with their lifetime trauma, and how it might contribute to their recovery. So this is the model of the mechanism of trauma transmission in my study. So the main focus is the grandma trauma exposure and symptom. And the mechanism of trauma transmission, I focus on the first one is the parenting style and behaviors. And the second one, I also focus on their psychological distress. And the outcome in the subsequent generation is I focus both on the psychological adjustment, which is depression, anxiety, and stress, and also physical well-being, specifically focused on the nutrition status of the grandchildren. And I also explore a more like positive aspect to know more about their coping responses and how it may have contributed to the post-trauma recovery. So for the methodology, my PhD project, it's comprised of 5 sub-studies. And the study 0, which is on the mechanism, the systematic review on the mechanism of trauma transmission, which I already presented earlier. And there are other 4 sub-studies that I adapt different research methods to deeply explore the intergenerational trauma and the mechanism. And within this, the main method of this PhD project is I use the oral history approach using the lifeline method of interview to explore the lifetime trauma of the grandmother. So I'm not just focused on their genocidal trauma, I also focus on their childhood trauma and what's going on throughout their lives until the present life. So for the overall sample of this study, I include both the primary data and then the secondary data. For the primary data, I was able to include 128 skip generation household from 4 provinces in Cambodia. And this 128 household was pulled out from a representative sample of 1,459 households in a project that conducted in Cambodia in 2018 that focused on migration impact from certain provinces. And I also use the secondary data, which is from this migration impact project. I was able to include 355 households that have the children, that the grandchildren was 0 to 3 years old back in 2018. And for the household selection criteria, I include the household with the same grandchildren and the parents still engaged in migration and the grandchild cared for by the same maternal grandmother. So this is the final participant sample of my study. So it's consists of the 3 generations in the skip generation household, the grandmother, the daughter, or the mother, and the grandchildren. And the grandchildren group, I have 2 groups, those who with those age 15 to 22 years old, and those who is now 5 to 9 years old. So now let me share with you the first study. The first study I tried to explore the parental style in the intergenerational effect of grandmother trauma. So as I mentioned earlier that the key mechanism of trauma transmission within Cambodian family is mainly through parenting style and family dynamic. And given the growth of the contemporary migration, especially among the middle generation, it's resulted in the increasing the skip generation household in Cambodia. And there is a study that showed that the grandmother who live in the skip generation household have some significant mental health disadvantages, as well as the left behind grandchildren. So when she's herself like dealing with her own trauma and at the same time perform a primary care for the left behind grandchildren. So it is interesting to explore more like in terms of how her own trauma may transfer to her grandchildren in the third generations through her way of parenting. So the hypothesis of this study one is focused on the indirect effect of the grandmother trauma symptom on the daughter and the grandchildren distress through its impact on the quality of her parenting style. So this is the sample of the first study. So it has 3 generations in the skip generation household. So for each generation, I measure the trauma exposure and symptom, also the symptom of distress. And I also measure the childhood trauma experience of the 3 generations, and also the experience of parenting within the family. So first, I just want to share briefly about the finding on the trauma experience across the 3 generations. So here is the comparison of the experience of childhood trauma across the 3 generations. So we can see here for the grandmother and the mother, the daughter generation, more or less they experience really like similar level of trauma throughout their childhood. But when we look at the green bar, which is the children experience during their childhood. So first we can see they experience more of some kind of abuse, both verbally and physically, which is a little like we can see it's higher than their grandmother and mother's generation. And also when we look at their experience of they also highly experience the loss of the parent, either through divorce or separation, and which is really makes sense in this context, migration context. And they also more likely to report living with the abuse, drug abuser or drunkard in the family, or living with someone with depression or mental illness. And there is a strong correlation between the childhood trauma experience of the grandmother with the childhood experience of their daughter and their grandchildren. Here is the lifetime trauma exposure of the grandmother. So we measure their experience in genocide, post-genocide, and the current trauma experience. So here we can see from the trauma exposure during genocide and the trauma exposure in the post-genocide, there is an overlap. Like there are at least several traumatic event that the grandmother in this study re-experience. It means they experience in the genocide and they re-experience again during the post-genocide. As you can see, the red underline here. And also for the post-genocide and the current trauma, most likely it's concerned the natural disaster and the money problem. And so we can see here the grandmother really re-exposed to similar type of trauma or experience the multiple type of trauma throughout their life. And from the overall sample of the grandmother, almost 35% of them meet the PTSD criteria, and more than half of them meet the anxiety and depression criteria. So here we do the comparison between the parenting experience across the 3 generations. So we have here 5 types of parenting style. And if we look at the inconsistent and the corporal parenting style, so from the grandmother generation, they are more experienced inconsistent and corporal parenting compared to their daughter and the grandchildren generation. But when we look at the post-supervision parenting, which is the middle one, we can see that the grandchildren in the third generation experience more or less similar level of post-supervision parenting from their caregiver, which is similar to their grandchildren, their grandmother. And lastly is the role reversal parenting, which is really the main focus of this first study. We can see that the grandchildren generation have a lower score and role reversal parenting, which is like they experience less role reversal parenting from the caregiver, which is the gold sign. And we can see that the mother and the grandmother generation has a high role reversal parenting experience. Also from the grandmother post-supervision parenting style and their corporal punishment parenting style is strongly associated with their PTSD symptoms. So we come to the hypothesis of the study one. So the first hypothesis is focused on the intergenerational trauma through the parenting style in the second generation. So we hypothesize that the role reversal parenting style of the grandmother would mediate the impact of their PTSD symptom on the psychological adjustment of their daughter. And so we use this mediation model for this to help answer our hypothesis. And we run a precondition of mediation. So to see the relationship between predictor and outcome, predictor and mediator and outcome. So we find the significant relationship between the PTSD and the outcome in second generation, which is only depression, but not anxiety. And we also find the significant relationship between PTSD and role reversal parenting. And then lastly, the significant relationship between role reversal and the depression of the daughter generation. So we was able to further the analysis of the mediational analysis. And for the result from the mediation result of the daughter depression, because there is no significant in the anxiety, so we only run for the depression. So from the 90% confident intervals, it does not contain 0, as you can see here, and there is no significant direct effect between PTSD of the grandmother and their daughter depression. So this criteria really support for the full mediational model of indirect effect of grandmother PTSD symptom on their daughter depression, which is mediated by the role reversal parenting. So we move on to the hypothesis within the third generation. So we hypothesize that the role reversal parenting of the grandmother would mediate the impact of their PTSD symptom on the psychological adjustment of their grandchildren. And we use the same mediation model, and we test also for the preconditions of mediation. But we only find a significant relationship between predictor, which is PTSD, and the outcome. Only one outcome, which is depression, but not anxiety or distress. And no significant between the predictor and mediator, and no significant between mediator and outcome. So we cannot run the mediational model for this one. And instead, I just run to test the significant direct effect. So there is a strong correlation between the grandmother PTSD symptom and the grandchild depression score, and no significant relationship found between the grandma PTSD and the grandchildren anxiety or stress. So now I will move on to the sub-study 2, which is the study 2 focus on the child nutrition. and the caregiver mental health, which focus on the trauma and distress. So from the literature, they show the link between the caregiver quality of the grandmother and the nutritional status of the left behind children. And there is also the link between the caregiver mental health and the stunting in children, especially those age 0 to 5. So this study the objective is to explore the mental health aspect of the grandmother, specifically focus on their trauma symptom and distress, and the association with the nutritional status of the grandchildren in the skip generation household. So with this study, I use two data sets. The first one is a secondary data that I mentioned earlier. It's we pulled from the representative sample of 1,459 households, and we was able to get to include 355 households with the children age 0 to 3 back in 2018. And then from these 355 households, we was able to get 82 households, which the children are now age 5 to 9. And the primary data collection was collected in 2023. And for the measurement, we focus on the caregiver trauma and distress. For the children, we measure their children BMI using weight and height. And we also include the household component, which is the food, the coping strategy toward poor food security, family income, and also the parental migration. So this is the relationship we want to find in this study tool. So we want to find the link between the caregiver trauma and distress, and also the household component, which mainly focus on the coping strategy, and the outcome variable is child nutrition. So the finding on the grandmothers from the data from 2018, it's more than half of them meet the anxiety and depression criteria, and it's the same for the data in 2023, which like more than half of them meet the anxiety and depression criteria. And more than 35% of the grandmother in this sub-study meet the PTSD criteria. For the grandchildren, for the nutrition status of the grandchildren, we include the stunting and underweight, and also we include the continuous Z-score, which is height for age Z-score and weight for age Z-score. And from the data in 2018, almost it's about 11% of them are underweight, and 21% of them, almost 22% are stunting. And the recent data, almost 26 underweight and almost 15% are stunting. So this is the overall finding of the data both in 2018 and 2023. So first, I just focus on the data, the finding from the children group in 2018 when they age 0 to 3. So we can see here the grandmother caregiver component, which is PTSD and distress. So we found the significant relationship between the high level of distress among the grandmother and the children, the underweight. And for the household level, the family income is significantly associated with both weight for age Z-score and height for age Z-score. And when we look at the parental migration, here we can see the duration of father migration, also significant correlated with this height for age Z-score. Now we look at the finding from the data in 2023. So here we can see the first from the household level. We can see the coping strategy in poor food security within the household is significantly associated with the both stunting and the high for agency score. And when we look at the parental migration, the both duration of father and mother migration significantly associated with the underweight and weight for agency score. And lastly is the relationship between father and mother duration of migration, also significantly associated with the high for agency score, but not stunting. So here's the conclusion of the findings. So from the data in 2018, the grandchildren who was raised by the grandmother with a high distress level would have a greater chances of underweight, and the household with high income associated with better nutrition in children, and the longer period of father migration wasn't the nutrition status in children. So for the study in 2023, we found no significant relationship between PTSD or distress of the grandmother and the grandchildren nutrition. And the grandchildren in the household with a higher score in poor food security have a greater chance of stunting. The longer period of father migration would worsen the child nutrition, and the longer period of mother migration, the better child nutrition. So I will go to the next sub-study, which is focused on the coping responses to the trauma among the grandmother. And this study, because in Cambodian context, we know there is an existing religious coping and cultural practice that have most of the elderly generation, especially like deal and cope with their trauma and distress. And there is this cultural specific representation of trauma, which we call broken courage. And also there is this specific culture specific expression that use a lot to express their distress and to express to their trauma, which we call thinking too much. And this thinking too much has a strong relationship with the PTSD symptom. So the objective of this study 3 is to explore the grandmother coping response and the trauma recovery. So we was able to include the 19 grandmother from the overall 128 grandmother, the overall sample, and we only conduct in Siem Reap province. And we use the a lifeline to interview to explore the childhood trauma and the other traumas throughout their life, and also focus on the coping, like the coping response and how they deal with their life in the present time. And so this is a sample of the lifeline method of interview that we conduct with the grandmother. So I will now go to the present, to present the 2 key themes that I found from this lifeline interview. The first came around the karma in Buddhism, and the second theme, which is the culturally bound expression, stop thinking or worrying a lot. So this is the first theme that we found from the interview with the 19th grandmother. More often they refer to it a result of karma for what happened. So it's in a way to have them make meaning of their past, their trauma experience. So this is the quotation that I get from the interview with those grandmothers. So a proportion of them refer to karmas to have make sense of their trauma experience. Mostly happen during the genocide. They use it a lot to explain, okay, what happened to me in genocide is because of my karma. Maybe I commit something wrong. This has happened to me. And here we can see some they say, oh, my karma is a lot. So that's why I have this really difficult life. So it's they use a lot to describe to make meaning of the trauma that they encounter during the genocide. But some more, but they also use it to describe the trauma that they experience in their current life, especially in the post-genocide and the current situation. So here, during the post-genocide, many largely the grandmother in our study exposed to extreme domestic violence. It's because they married to the abusive husband, alcoholic, gambler. So it's really, it's like for them, they use karma to really explain, okay, it's because of my karma, that's why I meet my husband, that's why I'm married to the drunkard, or that's why I'm married to the abusive husband. So the term karma used a lot to explain or to make sense of their experience, either in genocide and throughout their life. So this is the first theme, and now we go to the second theme, which is the stop thinking too much. This stop thinking too much or worrying a lot is, we call it a cultural specific expression, especially refer to the literature in Cambodia that the thinking too much is it's a cultural way of expressing their distress. So the grandmother here, like the way that they cope with their excessive thought over their traumatic experience is to stop thinking, to put the stop to their thinking and worry. And here's some of the code that I collect to support this way of coping. So it's in the way that they try to, or they want to stop thinking or reminding or worrying about what happened to them, in the way that they feel that there's nothing more that they can do to change the past, and it's already over, and so they don't want to think much or worry much about it anymore. So now I just want to go through the link between the two key themes. So the first theme, like I mentioned, is the karma, that used a lot as a meaning making of trauma. And the second theme, which is the stop thinking too much, it's more like to accept and make peace with the past, especially in this old age. And from the quotation here, we can also see the link between the meaning making using karma and the stop thinking, because at least it happened to few of the grandmother that when they believe that their trauma experience is the result of karma, they tend to stop thinking much about it because it's their karma, nothing else they can do anymore. And it's also more or less facilitate the stop thinking about their traumatic experience. And another significant element that make them stop thinking about the past is that they think there's nothing they can do to change it anymore. So this way of coping, it's in a way, it's facilitate the active participation in religion. So when they believe that the trauma is the result of karma, what they did in the past life. So it's by actively participate in religion, including like going to pagoda, pray, be married, or chanting, or listen to Dharma. It's in a way, it's believed, they believe that it's have eliminate their karma from, and then they can build a good life in their next life, no more karma. And this religious participation, it's also have most of the grandmother stop the excessive thought over their unchangeable past. So it's in a way make them calm in a way and not think or overthinking about what already happened in their past. And this the active religious participation also show that, according to the grandmother we interviewed, it really helped them to cope with some of their PTSD symptoms. Like we can see here the case of Supir. she told us that during the interview that she chant every day before every evening at night before she sleep, because she still really saying a lot about what happened during the genocide. She shared with us, and she still have the flashback, and chanting every day is really help her feel calm and sleep well. And the active religious participation, it's also help the grandmother more like accepting their past. Like what we see here, the case of Nari, that because she's saying like she saying more about the Dharma, the Buddhist teaching, and she focused more on that instead of overthinking about her past, and she was able to move on and continue with her life. So this is the overall summary of the two key themes, like the coping and the religious practice among the 19 grandmother that we interviewed. So I will move on to the last sub-study, which is the study 4, that this is the pilot study on saliva cortisol. This study, the aim of this study is to explore the psychobiological factor to explain the complexity of the PTSD among the grandmother, because the literature really show there is a link between the cortisol level and the PTSD, and the level lower or higher among the PTSD group is really different depending on the time we collect the saliva, the type of trauma, and the assessment tool for PTSD. So for this pilot study, we adapt the 3-time collection of saliva sample, and we use the lifeline interview while during the collection of the saliva. So we collect 3 times. The first time is the baseline, which is before we start the interview, the lifeline interview. The second is the cortisol response level. We collect when we expose, when the grandmother was exposed to their significant trauma experience. And the last collection is after we finish the lifeline interview. So the result for this pilot study, we was able to, so among the 19 grandmother, we was only 14 that have a complete 3-time saliva sample. And we divide into the PTSD group and the non-PTSD group. And we find that the mean cortisol level is higher in the PTSD group, even though it's not significantly different. And lastly, because we adapt the lifeline method for this pilot study, so we collect the saliva during expose them through the traumatic experience on lifeline interview. And it is challenging because majority of the grandmother, it's really their first time talking about their trauma experience, especially from the genocide. And some of them like really emotional already in the beginning of the interview, and some really delay in responding to their trauma experience. So they really become really emotional already, like almost the end of the lifeline interview. So it's really like the time in processing the trauma is really different, depend on how, I think, the individual differences of the grandmother. And it's because they don't really talk about it for a long time already. And the last challenge, another challenge is it's really challenging to identify the significant trauma experience. It's because, well, I mean, they experience multiple types of trauma throughout their lives. So even it's really hard to identify which trauma is the most significant one. So it's these 2 challenges, it's lead to a methodology challenges that create the measurement error. So that's why there is we cannot really find a significant relationship between the 2 groups. So now it's come to the conclusion and discussion of the 4 sub-studies. And I will discuss this 4 sub-study in response to the main research question of my research project. So the first research question that I focus on the overall mental health implication of the grandmother in the skip generation household. So the 4 study contribute to this specific research question that we found the high prevalence of PTSD and distress among grandmother. Mostly it's because of the cumulative effect of trauma exposure that they experience throughout their life. So it's including the childhood, poverty, violence, and family separation and loss in the genocide, and still they exposed to extreme domestic violence and poverty in the post-genocide and the current. And within giving the context specific of skip generation household, many of the grandmothers still living in poverty, and also the care burden in the skip generation household, it's to some extent exacerbated their PTSD and distress symptom, and also trigger their past trauma. And for the biomarker for PTSD from the pilot study, it at least show us that the PTSD group have a higher level of cortisol level. And this really is because of the small sample size and the non-significant differences between the two groups. So it's really suggests for the bigger study and to explore more on this biomarker for PTSD among the Cambodian population. So now we go to the research question 2, which focus on the mechanism of intergenerational trauma and the outcome in the subsequent generation. So the study 1 and 2 contribute to this research question. So we found 2 direct effect from our study, the study 1 and 2. So the indirect effect we found is through the role reversal parenting, and it's significantly found in the second generation, but not in the third generation. And the role reversal parenting as a mechanism of trauma transmission that we found in this study is really consistent with the 2 studies of Phil and his colleagues. Another indirect effect that we found is through the symptomatology, that the depression of the grandchildren in the skip generation strongly associated with their grandmother level of PTSD. And although there is no indirect effect found through the way of parenting, specifically the role reversal, the grandchildren in the third generation are more vulnerable to adverse trauma, mainly because they grow up with the grandmother that are poorly supervise them, more like a poor supervision parenting, because it maybe because of their high level of PTSD that influence their way of parenting and supervise the grandchildren. And lastly, we found the poor nutrition among grandchildren age 0 to 3 is linked with the high level of distress of their caregiver, the grandmother caregiver. Lastly, the last research question, which concerning the coping response and trauma recovery, we was able to found that the Buddhist informed values and practice and cultural specific expression in dealing with distress or trauma, it contribute to, it's helped the grandmother in this study deal with and heal from their trauma and loss. But sadly, this technique or coping strategy, it doesn't work for all the grandmother as shown in our study, especially those grandmother that really have traumatic and adverse childhood experience and still living in the negative environment. So it's really signify the need for a professional mental health care for them. Now it's come to the limitation of my study. So the finding of this study is really concerned the representativeness of the participant sample because of the small sample size, and it's maybe it's tricky to generalize the finding. And the second point is the absence of the control group, because we was not able to include the non-migrant household in order to compare. And thirdly, it's the different measurement that we use, especially in the third generation, that would influence the significant finding in the third generation. And the last limitation concerning that we were not able, the lack of the qualitative data, especially in the offspring generation. So we was able to only collect the qualitative data within the caregiver generation, but not the subsequent generation. For the implication, the first concerning the academic implication. So this study contribute to the methodology gaps, which is specifically on the mixed method research. And this study contribute to the finding on the lifetime trauma of the of the caregiver. And we found also that the PTSD of the caregiver strongly related to both the genocide and the current trauma. So not just the genocide experience. And we was able to also explore the offspring trauma because we want to examine or explore the unique effect of the caregiver PTSD on the offspring distress by controlling for the offspring own traumatic experience. And we were able to identify the cultural and contextual response and coping among the grandmother in Cambodian, like how they use the values, like cultural values and religion in helping them cope with and make sense of their trauma. And this contribute to a therapeutic treatment plan when we work with the trauma survival, especially among the elderly generation in Cambodia. And now we go to the practical implication. So with the increasing of the parental migration in contemporary Cambodia, there are a significant growth in the skip generation household in Cambodia. And this skip generation household is now become a new form of household structure in Cambodia nowadays. And within this household, from the finding from my study suggests that there is a significant psychological disadvantages for those among those who live in this skip generation household. And the evidence of genocidal trauma is shown to still transmit from one generation to the next, either through direct or indirect pathway within the Cambodian family. It's because it's because of the untreated trauma in genocide among the grandmother, and most often compounded by their current poverty and ongoing exposed to trauma or distress during their current life. And within the skip generation, it really affects the grandchildren who live in the skip generation because they grow up and was raised by the grandmother, the grandparent, who still struggling to cope and heal from their own unresolved past trauma. So the finding of my study really contribute to the new knowledge and understanding on the trauma transmission, specifically within the skip generation household. And this finding would have to plan and shape the future intervention and development, as well as the policy making. And for the future direction, it would be really interesting to include the control group and to see and compare the different. And it's really strongly suggest to use the same measurement across the generation, especially when we want to explore the intergenerational trauma across the different generations. And another point for the future direction is it would be also interesting to further explore the indirect effect of the grandmother trauma on the grandchildren nutrition outcome through their parenting behavior or styles. And lastly, it would be really interesting to also obtain the qualitative data from the subsequent generation which is the generation, second and third generation, more likely to explore their perspective and their experience because they grow up with their grandmother who still suffer from their own trauma. So that is all for my presentation. Thank you for your patience and listening.
Welcome, Chirantidan. Thank you for that, a really interesting, fascinating presentation. There's so much to talk about here. I wish I were an expert in this topic of trauma and psychology and recovery so I could ask more intelligent questions. Before I make a stab at it, let me just see if we have any questions from our audience. Let me read, there are two here, so let me begin with these. I'll just read it straight. Thank you for your important presentation. My name is Kok Satanit Tanit. As you may know in your study, most grandmothers became caregivers for their children because many parents migrated to work in Thailand and South Korea for better incomes. So that left a huge burden of care for their care for the children to the grandmothers. Absolutely, grandmothers have experience with stress, depression, anxiety. This is the question. So do you know how many of them have access to mental health services or trauma treatment, which is something that you brought up, the lack of resources available to them? To the grandmother.
Okay, so I answer the question, this question, and then we go to the next slide. Okay, so thank you so much for the question, Tanit. So you from Luang Corporation. I used to also work for 3 years with Luang Corporation as a research coordinator. And yes, in terms of your question, it's really a good question because I think when I work with, because I also used to work with TPO and as a psychologist, and I also used to work like doing like quite several research on migration and also the healthcare of the migration. And also, so this question is specifically for the grandmother and how many of them access to mental health care service treatment in Cambodia. Well, actually, I would say I cannot give you the precise answer to this. But what I would say is that throughout my experience and also my experience as a researcher, also as well as a psychologist, because I work a lot in the community in the past 8 years doing research and provide psychological intervention, I can tell that not many grandmothers, especially in the rural area of Cambodia, have the proper access to the mental health care service. Even for general care and for trauma, it's even challenging because there is no, because there is the lack of resources, which is basically in the rural area in Cambodia, to really have the resource person to know like trauma treatment and have those grandmother deal with their trauma or cure from their trauma. So the services is really limited for them. That's why, from time to time when I conduct the same research on the trauma experience and the symptom, the distress of the grandmother, the grandparent in the community, in the countryside, still there's always still a high symptom among them. So sadly, I don't think there is enough. I don't think there are many of them have the access to mental health care service.
Thank you, Tita, for the response. This next question is really a little off the topic, but I'll just read it anyways. It's the question, the attendee asks, did you did you come across any information regarding the experience of the parents who went to other countries to work and whether or not they were successful earning money and being able to send it back, or were they victimized during their experience? And perhaps that did impact the level of trauma within the family because of this, another traumatic experience as a result of migrating for work.
It's interesting because so this is really specifically focused on the parent who migrate. Yeah, because I used to enroll in one of the big research project which is focused on the migrant impact of the migrant impact. And during this research study, we also asked a lot about like migration history of the parent. And even like my PhD project, this study, I also asked the history of the parent migration. So yeah, I don't really like use the data for this study, but more like to understand their I think the living condition of the skip generation household. But I would be able to say that yeah, we really hear the story about the migrant who migrate to other country, and especially those who migrate without a proper document, like we call it illegal migration. So yeah, they used to be I think they used to bring to jail in Thailand and then bring back home, and then they go again, and then it's happened again. And we also hear the story about that they was cheated by the boss back in the country of destination. And in terms of the remittance that's sent back to the migrant household, we heard a lot of story that the parent who migrate was not able to send back the remittance. So we don't know. And some family that we interview never heard back from the parent, like the parent who migrate, and they have no idea what happened to them in the country of destination. So they didn't hear anything and they don't get any remittance. So yeah, we hear that kind of story during our interview. Yeah.
Great, thank you, Tita. As you were talking, it made me think about the study number 2 about the child nutrition. And I would wonder if there is a link between the level of remittances and the data on underweight children or stunted children because of the level of remittances. Presumably, if the parent who migrated to work was able to send back money to the household, there would be less likelihood of nutritional deficiencies among the third generation children. So I wonder if that did come into your study as you were looking at the nutritional levels of the children, whether or not if the level of remittances impacted that data.
Okay. Thank you, George, for this question. For the sub-study too that I focus on the nutrition, and especially from the secondary data back in 2018, where we also collect the family household income, and this household income is also included the remittance from the migrant parent. So yeah, in the study really show that there is a link. So the household with the higher income, which means that they receive properly, like maybe the good amount of the remittance from the parent, it's really contribute to the better nutritional status among the children. Because we focus on only the family income, not really specifically separate the income, household income and the remittance. But in the skip generation household, most of the income is really from the migrant remittance. So it's really the income or the remittance is really clearly linked to the better nutritional status for the left behind grandchildren.
There's quite a few questions that have come in here now. Let me read this one. This deals with the coping mechanisms that you were talking about. The listener, the viewer asks, I am curious to hear more about the language around experiences of trauma. The phrase thinking too much is familiar to me from my work with refugees from elsewhere in Southeast Asia. The term broken courage is new to me. Can you talk more about how this term was used? What does broken courage describe? For instance, was it used to explain panic attacks, etc.? Could you tell us the, by Klahan, or what is the Khmer word for broken courage? Bombay Klahan, or what would it be?
It's the broken courage in Cambodian term we call basbat.
Okay.
Yeah,
That's
this one is really actually it's Dr. Chum Sutira. He's the director of TPO, the Trend Cultural Psychosocial Organization. He's the one who invented this term because he conducted his PhD, which is specifically focused on this cultural coping, like cultural responses. And he came up with this term, broken courage or basbat. And actually, it's more like, if I just put it in the easy way, this basbat is more like, for Cambodian, when we experience something really dangerous, really extremely harmful to our survival, we turn to like not really dare to act anymore. Like we really just don't want to know about it, don't want to hear about it. We just want to like do nothing so that we are safe. So this is like really a simple way to explain the term basbat. And it's really, it's really common way of respond to trauma, especially among Cambodian, like in the Cambodian context.
So do the recipients that were interviewed, do they use the term?
Well, actually,
that was just coined by this person that you just mentioned?
In the interview, because but actually I'm sure that during the interview when we invented this term, there are like the respondent that use this term, but specifically in my study we don't really like focus so much on the terminology or the symptoms. So especially when we conduct the lifeline interview with those grandmother, we just really ask really simple way of, okay, please tell me more about your experience in this time and that time. And we don't really direct them with any term or any word. So I'm not, so the term of basbat is not really emerged in this study from the participant, because it's not really one of the thing, the term that we specifically focus on. But the thinking too much, I think you are familiar with this. It really expressed a lot throughout the interviews. Like, I think a lot about this. I worried a lot about this. Now I don't want to think about this. I want to stop thinking about this. So I think the stop thinking we hear a lot, but not the basbat.
Baksabat. Yeah, an interesting comment by Isaac Lin about that term, Baksabat, that it has a political implication. Are you aware of that, or that that former prime minister had said at some point Cambodia is beyond Baksabat? Perhaps not.
Oh, yeah, I saw this question. It's more like a political implication. Well, I mean, I can only explain it as from a psychology point of view. Yeah, the basbat is really relevant among Cambodian to really express or respond to something that is really traumatized for them. So we use basbat. It's mean like, yeah, it really affects them so much that they don't want to act anymore. So it's like broken courage, no more courage.
Yeah. Thank you. Let's just see. There's quite a few questions here. I kind of lumped them together so we can try to get through as many of the questions as we can. There are several questions here about the level of care and the amount that the government spends on healthcare. you know, it's interesting that I just personally came across the government new system that goes by the acronym BOSS. And you know, one of the questions here is talking about the level of investment in national health care. And I was really impressed to see that this program that goes by BOSS provides extensive healthcare treatment for people of all of incomes. You know, my assumption has always been that if you go into a hospital, no matter where or what, you're going to have to pay for your care out of pocket. And now that's undergoing quite a big of a change, significant change. Do you know if in that system of the BOSS, if mental health is included as well?
Well, actually, I'm not able to explore this so much, but I'm not sure that it's include the mental health care services in the also.
Yeah.
But yeah, I can explore more about this because actually I'm not really the member of also because I'm not really a full-time work, or I don't really have a more like a full-time job in Cambodia, so I'm not really I don't really benefit from the boss also. So for
And
years,
also,
so I really have to
it's
explore more.
relatively new, that the program is relatively new for most people. I know government employees had access to this program previously, but it's just recently, apparently, from what I understand, opened up to the general population as well, so anybody can sign up for it. I was at the office in Siem Reap recently, and it was crowded with many people applying for it and getting into the system. But I just wanted to also ask you, in general, such a fascinating topic, you know, studying these skip generations and how it relates to the specific economic phenomenon, you know, that Cambodia has experienced in, I guess, the last 15 years, especially, right, with secondary migration for work purposes, not to emigrate to third countries to live, but just to work with the intention of coming back, presumably. Although, as you say, some of the parents don't. So to study this and the way you did seems to be a very brilliant, if I can use that word, topic to focus on. And I'm just wondering what led you to that idea that you should study how the trauma of the grandmother's generation, who were presumably survivors of the Khmer Rouge, have impacted the grandchildren, whose parents, I guess, would not be of the age, they would be too young and born after 79. So it'd be the grandparents who were, you know, more severely traumatized. So as to identify this as a research topic, because of this phenomenon of the parents not being there, as you said, a future study would include the control group, the study of the parents and how the results were different for the impact on the children. If you looked at just the families with parents who stay at home and don't migrate away to work. But to identify that as a topic, well, we have this problem and we have this phenomenon in Cambodia with the parents going to work in Thailand. We should study how the parents who are survivors of the Khmer Rouge and traumatized by that experience, how that has impacted their grandchildren. So if you could just talk about how you arrived at that topic. I find it very fascinating.
Thank you, George. Well, actually, this intergenerational trauma specifically, like this topic was introduced to me by one of my supervisor. Is the advisor, actually he's the professor back in the US, and actually he already passed away like several years ago. And he's the one who introduced me this topic when I'm doing my bachelor degree in psychology at the Royal University of Phnom Penh. Yeah, I work, but I only focus on the trauma within the first and then the second generation. And that's when I come to know the trend trauma like intergenerational trauma. And then when I go on to study gender, and then later on I pursue my PhD, I don't really think about this topic anymore. Like I think it's more like I want to only focus on something else, just maybe the the general impact of migration on psychological well-being of the grandchildren. But then, from time to time, when I start working on my PhD proposal, and I have my advisor, I'm not sure if she also here. I talk to her, and then she started to again talking to me about the trauma in Cambodian population, because I know about this trauma and then Cambodian population, but I don't really want to work on this anymore. I don't know, in the way that I want to already move on from this topic. But then she introduced me again to the trauma, and then I start to, okay, maybe start the trauma within the migration context. And then because I involved a lot in the research in the past, when I worked for Luang Corporation, I manage a big research on migration and impact. And we study a lot, like we know a lot about this skip generation household, and also study the impact of the psychological consequences of the left behind children. And then with all of this, the background knowledge from the migration and my experience working on trauma and the intergenerational trauma. And then I come to try, okay, maybe I emerge this, like the intergenerational trauma, but within the skip generation household. And why it really pushed me further is because it's also, I think I'm also the second generation, because I think my parents also go through the survival of Khmer Rouge genocide, and my house in in my family is also a 3-generation household, because my sister have the children, and then my mom taking care of my niece and nephew when my sister went to work. So I see this every day at home. So it's really linked. It's really made me curious because of my own experience. I see how my mom raised my niece and nephew, which is the grandchildren for her, the 3rd generation. So, and I see there is still a problematic, especially the way that I think mainly is the parenting behaviors of the grandmother who went through war, and they still really suffer from their own trauma. So with this kind of professional and personal experience, so I decided to include and explore more of this transgenerational trauma aspect, focus on the skip generation thing. I call it the skip generation because the 2nd generation is not there anymore. It's only the 1st generation and then the 3rd generation, and what's going on there when there is an absence of the middle generation. And the grandchildren is really small. They really need a lot of care, attention, and secure attachment. And how much the grandmother who experienced the trauma from the genocide and still struggle to heal, how they can respond and meet the security attachment, or to provide the safe and secure attachment to the grandchildren in the household. So that's what encouraged me to explore this topic, because I know there's still some disadvantage and problematic there.
Very interesting. Thank you. I want to read this response by Hannah Marcuse, I believe her name is pronounced. She explains a little bit about the BOSS-SAW program. It's also known as the NSSF program. And she says it covers that program, which is different than the one I guess I was referring to, covers civil servants and private sector workers. And she says she doesn't believe it covers mental health.
Yeah.
There's another fund, the Health Equity Fund, which covers the poor and vulnerable, according to Hannah. And that does cover user fees for mental health consultations at public hospitals. So that's really interesting. She just added, NSSF recently expanded to self-employed on a voluntary basis. That is the new change I referred to. Right. So she seems very aware of this program and very knowledgeable. I think there's time for a couple more questions. So let me ask you a little bit more about the oral histories and the lifeline interviews that you did. And if you could just talk a little bit more about it. because, you know, we hear so much about how telling one story can be difficult, but also very therapeutic. And it reminds me of, you know, the first time I came across anyone doing work on mental health in Cambodia was Dr. Richard Mollica from Harvard University. I imagine you're very aware of his work, since he kind of pioneered really this work with trauma with refugees and victims of genocide. And I'm wondering if you have any more thoughts about the therapeutic effect of oral histories and lifeline interviews. What makes them so effective and interesting?
Well, actually, originally I don't plan to use the lifeline method, but then because when I work with TPO as a psychologist, I use a lot of this approach, the life history, the oral history approach, and it's really powerful, especially when we work with empowering the genocide, like the survivor from genocide, because it's not just purely telling the story and then that's it. It's also about, like, during the process of telling the story, we also allow them to get in touch with their own emotion than linked to the trauma. Because I worked for several years with especially the grandparent that experienced the genocide. They can't really tell anything. They can tell really broadly about their experience. It really detailed about the experience, but most of them, there is no emotion connect to those traumatic experience that they share. So it's like the story is there, but the emotion is not there. So using this oral history approach, it's really like to give them time to share whatever, like their experience. And at the same time, we allow them to process their emotion and reconnect with their trauma, which is really the critical part of trauma recovery. It really to restore the trauma experience and be able to process the emotion and reconnect the emotion with those trauma. So that's why I decided to use this approach, and in a way to not just get the story from my research and then leave them alone. So I also want to have them to reprocess it and get in touch with their story, and at the end also feel empowered, because you know they went through a lot from their childhood until now, but they managed to survive and they're strong. So this is also what message I want to give them from using this oral history approach.
Yeah, you mentioned being empowered, and that does seem to be a very interesting and fascinating aspect of oral histories and storytelling, is how it does empower the storyteller when there is a active listener who acknowledges and validates the story. And it reminds me of the work that I've seen on the use of narratives, or the way that narratives work in these kinds of situations where the traumatized or the traumatic event resists that kind of narrative. It's not easily put into a narrative structure with a beginning, middle, and end. That's, I suppose, the nature of trauma, that it resists that kind of organization. And that's why it supposedly is so disruptive to the victim's ability to process and think. So the telling of the story, I was just wondering if if you've had any you've done any work with this idea of the way that a narrative empowers the storyteller by controlling the traumatic event. In other words, putting it in a structure that can then be better understood. And as you were talking earlier about assigning meaning to those events that seem to be so incomprehensible, that, you know, why did this happen and how could it happen? But the power of a narrative for, you know, imposing some kind of narrative structure and meaning to the traumatic event as a way of integrating it into the person's understanding of who they are and what has happened to them, their personal story.
Yeah,
Question,
actually,
yeah.
Okay, you can finish that.
So I
So
was just going to say, I just wanted to sum up and say that, so my question
Ah.
involves that, what, if you've had experience with just looking at narratives as that, in that way?
yeah, I think the aim of this his oral history approach is more like to focus on the narrative, and also I also want to identify that, like, to also stress that the karma and then the thinking too much that emerged throughout the interview, the lifeline interview. It's not really, we don't really have we really have the like some key topic or question to ask them, but we never mention about anything related to religion, Buddhist karma in Buddhism, or thinking, or think. We don't really talk, we don't really like have the question regarding to that. But I think throughout the story, they just come out voluntarily, the term karma used, and then the coping response through stop thinking too much about their trauma. So yeah, it's in a way that it just emerged without asking the way they cope using the karma in Buddhism, and the stop thinking too much.
Yeah, that's very interesting. And one of our listeners, Sopan, made a similar comment just now that storytelling has kind of been broadly used in Cambodia. And his comment is that it's virtually the same, it serves the same kind of function as the idea of karma, of he says embeddedness. It is the same, the embeddedness of karma faith. Perhaps, yes. I don't know if I agree with that, but it kind of comes along with what you were saying. Basically, to kind of finish up, because we're down to our last couple of minutes, there's several questions here that just deal with treatment and the availability of treatment. And there's a question here, how do you deal with a traumatized person? So maybe we could close with just your thoughts on not only the availability of treatment, but maybe the awareness of treatment. It seems that many people feel that their trauma is not treatable. That, as you kind of referred in many of your coping comments, that it's a result of karma, it's beyond my control, there's nothing I can do, that the process of healing is not an active process where coping strategies can be identified and employed on a daily basis. I'm just wondering what you think about not only the availability of treatment, but people's openness to the idea of actively pursuing a process of healing.
Okay. Thank you, George. Yeah, to wrap up with this presentation, and I also see the question from Supan addressing the passive response when using the karma. Well, actually, and overall in the trauma treatment, yeah. Okay, first I just want to highlight the karma and how I learned from this interview. We also, there is some study that I read that also say that the belief in karma in response to trauma is also imposed the submissive response to trauma. So they say, oh, nothing I can do, so I just stay there because nothing I can do. But what different, and what I found differently from my study with this grandmother, it's different because of the trauma that they experienced in the past. It's happened like 40 years ago, 30 years ago. So the trauma is not there anymore. And it's different because the study that say that the karma can be a passive or submissive response to trauma, it's mostly conducted with the women that experience current abuse by their husband. So it's a different time. It's a different time when the trauma occur, because when you use karma as a way of interpret the current trauma, it really reinforces the submissive attitude toward trauma. So you don't fight, you just stay because you think it's your karma. But what happened to the grandmother in my study, they use this to really make sense of what happened to them in the past. The trauma that happened already in the past is already ended. like the violence, like the domestic violence that happened to them is already in the past. Most of the husband already passed away, so they really already in a more like better position compared to what happened to them in the past. And even the genocide is already in the past. So, when you use karma to make meaning of what happened, especially when the trauma is occurred in the past, it's also in a way help them to come to accept. Because, when you still try to fight, when you know that there is nothing, you cannot go back to the past and change what happened, it's already too late. And the only way to also live happily and make peace of what happened in the past is to really accept, okay, nothing else I can do anymore, and this is what it is, so I just have to move on with my current life now. So this is really what happened to the grandmother. So I don't think it's a submissive or passive response, because it's the kind of trauma that already over. And in this age, like it's like in their old age, in the last stage of life. So they want to make peace with whatever happened to them in the past, in a way that they die in peace. So this is really their main, it's really what they really want in their old age. And the karma and the dharma, the religious participation, it really helped them make peace of what happened to them, accept and calm, and not really overthink about the past that they cannot change anymore. So I can just say this is from the experience that I learned from those grandmother that I interviewed. But when the karma used for the current trauma, it can be passive and submissive. So it's just the time and the type of trauma. So it's not truly for all the type of trauma.
So in closing, how do you see the development of care and resources for people who are looking for it happening in Cambodia? Do you see, I mean, it seems as though there's a greater awareness of the effects of trauma on Cambodian society. Do you have a sense of the level of care that may be available to people going forward? Will it?
Well,
Sorry,
actually, based on the work experience that I done in the past several years, and then also the research, because I conduct a lot of research around in the country asking about this mental health problem and care. So I would say from the perspective of a researcher and a psychologist, I would say that the mental care also is improved, it's better compared to the past 10 years. And especially also young people know a lot about mental health, anxiety and depression. And also the government, I would say that they also try to put some effort, resource and funding on the development of the care, especially on mental health care in the community, in the hospital, provincial hospital or district level. And also a lot of the work of the NGO, the non-governmental organization that also work to promote mental health in the community, strengthen the healthcare system, build the capacity of the nurse and the medical doctor to also can to be able to diagnose and provide the medicine, or at least diagnose some basic mental health problem. So yeah, I can see the improvement, and yeah, it's really pleasant thing to see. Yeah, it's a good thing to see.
Well, that's very encouraging and hopeful. Well, Tita, thank you again so much for this really interesting presentation. We're very grateful to have had this chance to listen to you. So thank you. And I think we'll wrap things up right now. We're past our time. So thanks again, and good luck with your future research.
Thank you so much, George, and really appreciate that.
You're welcome. All right, then.